The annual general conference of the Ghana Medical Association is their biggest in the whole year, where doctors all across the country congregate at one center where they deliberate and also take stock on their welfare issues as well as other pertinent issues in the health sector. The Omahine of the Essikado traditional area, Kobina Nketsia V, who was the keynote speaker, in his address stated that public office holders, especially politicians, should be made to sign an undertaking that will ensure that they do not seek medical attention outside the country.
Those in public services, most especially those who call themselves politicians with public appointments, they should sign an undertaking that anything to do with their health, they will stay in Ghana. If the Ghana Medical Services cannot treat you, fix it. Then what are you there for?
President of the Ghana Medical Association, Dr. Frank Sribo, raised concerns about the impact of galamsey on the health of the populace. He called for an urgent intervention.
Incidence of cancers, genetic malformations, and I'm sure those of you who work in these areas will attest that you are seeing children with some genetic malformations that hitherto you were not seeing. And other waterborne diseases is on the rise in Ghana, especially in areas where galamsey is rife. And even for those of us who live far away from these areas, we buy the cassava, eat the fish, eat the farm produce from these areas, and we are also taking in the chemicals. So we are not safe. This shall continue to rise if nothing is done about the matter of illegal mining. Ladies and gentlemen, we need to exercise some dichotomy of control in this matter of galamsey. It is true, we cannot control where the gold can be found, but we can control how it is mined.
Deputy Finance Minister Abna Osei Asari indicated that government intends to engage in doctors towards the implementation of exemptions in the importation of vehicles.
Admittedly, our pledge to offer exemptions for the importation of vehicles for doctors have delayed. This was largely due to the efforts to comprehensively streamline our exemptions regime. Thankfully, Parliament passed the exemptions bill last year, and we are now repositioned to engage or in an engagement that we believe will manifest in this important pledge to ease the transportation burden of our doctors.
The conference was on the theme, Advancing Universal Health Coverage. Who cares for the health worker? Irama Smith, TV3 News, Takoradi.